Have you ever looked down at your hands, noticed those faint vertical lines running from cuticle to tip, and wondered whether your body is trying to whisper something to you long before it needs to shout? Nails are not decoration alone. They are living records, slow-growing archives of what is happening beneath the skin, shaped by biology, time, and resilience. When vertical ridges appear, they often invite unnecessary fear, but they also invite curiosity, and curiosity is where real understanding begins. Vertical ridges on the nails begin deep within the nail matrix, the small but powerful zone where new nail cells are continuously formed. This matrix works quietly, responding to signals from hormones, nutrients, blood flow, and cellular energy, shaping how each new layer of the nail is produced. When cellular renewal is smooth and evenly paced, the nail surface appears uniform, but when that rhythm subtly changes, the evidence travels forward as faint vertical lines. These ridges are not sudden events, they are slow records of cellular behavior over weeks and months, written in keratin as the nail grows outward. As the body ages or adapts to internal shifts, the speed and coordination of cell division in the matrix can vary. Some cells may produce slightly thicker strands of keratin, while others produce thinner ones, creating gentle grooves that align with the direction of growth. This alignment is important because vertical ridges follow the natural movement of nail formation, reflecting an adjustment rather than damage. The body is not breaking down. It is reorganizing its priorities, allocating resources in response to time, stress, and recovery. These changes often occur without pain or dysfunction, which is why they are so easily overlooked or misunderstood. Nails grow slowly, so the ridges represent past biological moments rather than immediate problems. A period of stress, illness, nutritional imbalance, or even rapid aging at the cellular level can imprint itself here long after the body has moved on. In this way, vertical ridges act like growth rings in a tree, revealing shifts in internal conditions without announcing them loudly. Understanding this process invites patience rather than alarm. When we recognize that nails reflect cellular renewal rather than cosmetic perfection, we begin to see them as indicators of adaptation and resilience, shaped by the body's constant effort to maintain balance in a changing internal environment. As the years pass, the body's systems do not stop working, but they begin to work differently, and the nails quietly reflect this transition. Aging influences the way keratin is produced, organized, and hydrated within the nail plate. The cells responsible for nail growth divide more slowly and with slightly less precision than they once did, not as a failure, but as a natural shift in biological tempo. This gradual change can lead to subtle variations in thickness and density along the length of the nail, which appear on the surface as vertical ridges following the direction of growth. Hydration also changes with age, both systemically and at the level of the nail itself. The nail plate loses some of its ability to retain moisture, making it more rigid and less flexible. When hydration fluctuates, microscopic contractions and expansions occur within the nail structure, encouraging the formation of fine lines. These lines are not cracks or weaknesses, but adaptations to a drier, slower renewing environment. The nails, like the skin, become more honest about time passing, revealing texture where smoothness once dominated. Circulation plays a quieter but equally important role in this process. As blood flow becomes slightly less efficient with age, the delivery of oxygen and nutrients to the nail matrix can vary. Even small changes in this supply influence how evenly keratin cells mature and align. Over months of growth, these minute differences accumulate into visible ridges, making the nail a long-term reflection of systemic aging rather than a sudden change. Seen through this lens, vertical ridges are not signs of decline but signatures of continuity. They show that growth is still happening, just under new conditions. Aging does not erase biological intelligence, it reshapes it. The nails become a record of endurance, adaptation, and the body's ongoing effort to maintain structure and function despite the inevitable shifts that come with time. Nails sit at the far edges of the body's circulation, which makes them especially sensitive to the quality and consistency of internal nourishment. Every cell in the nail matrix depends on a steady supply of oxygen, minerals, vitamins, and amino acids to divide and mature in an orderly way. When nutrition is balanced, keratin formation remains relatively uniform, and the nail grows with a smooth, predictable texture. When that balance wavers, even slightly, the matrix adapts, and the adaptation often becomes visible as vertical ridging over time. Iron supports oxygen transport, allowing rapidly dividing cells to sustain their energy needs, while zinc and biotin influence how keratin is structured and stabilized. B vitamins help regulate cellular metabolism, ensuring that growth signals remain coordinated rather than fragmented. When any of these elements are inconsistent, the nail matrix does not stop producing cells, but it may produce them with subtle variations in thickness and alignment. Because nails grow slowly, these variations stretch longitudinally, forming lines that mirror the timeline of internal nutrient availability rather than a single moment of deficiency. Blood circulation amplifies this effect. Nails receive nutrients after the body has prioritized vital organs, so reduced blood flow, whether from cold exposure, stress, sedentary habits, or vascular changes, can affect nail growth quality. Reduced circulation does not always produce dramatic symptoms elsewhere, but the nails often respond quietly. Vertical ridges can appear as a sign that delivery systems are working, but not optimally, asking for support rather than signaling danger. What makes this process remarkable is its subtlety. The body communicates without urgency, offering clues rather than alarms. Vertical ridges shaped by nutrition and circulation are reminders that health is cumulative and continuous. Small, repeated choices in diet, movement, and stress management influence cellular behavior over weeks and months, leaving gentle impressions on the nails that reflect the ongoing dialogue between nourishment, blood flow, and biological resilience. The surface of the nail is constantly negotiating with the external world, responding to water, air, temperature, and chemical exposure in ways that are easy to overlook. Each time the hands are washed, submerged, or exposed to detergents, the nail plate absorbs moisture and then releases it again. This repeated cycle of swelling and drying creates subtle structural stress within the keratin layers. Over time, these microadjustments can align along the natural direction of nail growth, gradually expressing themselves as vertical ridges rather than sudden damage. Household cleaners, soaps, and sanitizers strip away protective oils that help maintain flexibility within the nail. Without this protection, the nail becomes less resilient to environmental fluctuations. Dryness increases friction between keratin layers, making the surface more prone to textural changes. Vertical ridges in this context are not signs of internal imbalance, but physical evidence of adaptation to repeated external challenge, similar to how skin thickens or lines form in response to chronic exposure. Temperature also plays a role. Cold environments reduce blood flow to the extremities, briefly limiting moisture and nutrient delivery to the nail matrix, while heat increases expansion and fluid movement. When these temperature shifts are frequent, the nail grows under alternating conditions, which can subtly influence keratin organization along its length. The result is a nail surface that reflects environmental rhythm rather than biological malfunction. Even habitual behaviors contribute to this process. Frequent hand washing for hygiene, prolonged glove use, or occupational exposure to water and chemicals all shape nail texture over time. The body responds intelligently, reinforcing structure where it can, adjusting where it must. Vertical ridges formed through environmental interaction are signs of endurance, not fragility. They reveal how the body continuously adapts to its surroundings, recording daily interactions in a quiet, physical language that reminds us how closely health is tied to the environments we move through each day. When changes appear in the body, the instinctive response is often fear, as if every visible difference must point to something going wrong. Vertical ridges on the nails challenge this reflex by inviting observation instead of alarm. The body rarely communicates in absolutes. It speaks in patterns, textures, and timing. Nails, in particular, offer context rather than conclusions, and understanding them requires patience, curiosity, and a willingness to see health as a dynamic process rather than a fixed state. Awareness begins by looking beyond the nail itself and considering the whole person. Are there changes in energy, digestion, skin, or overall well-being, or are the ridges simply present without any accompanying symptoms? In many cases, they exist in isolation, reflecting age, environment, or past stress rather than current illness. Compassion toward the body means recognizing that not every signal demands intervention. Sometimes it only asks to be acknowledged and understood. When concern is appropriate, it arises from patterns rather than single signs. A sudden change in nail texture combined with discoloration, pain, or systemic symptoms carries a different meaning than stable ridges that have slowly developed over years. This perspective shifts the focus from self-diagnosis to informed attention. It encourages people to seek guidance not from fear-driven assumptions, but from thoughtful observation and professional insight when needed. There is a deeper lesson here about how we relate to our bodies. Nails remind us that health leaves traces, but those traces are not judgments. They are records of adaptation, survival, and constant adjustment. Approaching these signs with awareness and compassion transforms anxiety into respect. Instead of fighting the body or obsessing over perfection, we learn to listen, respond gently, and support the systems that quietly work every day to maintain balance in an ever-changing internal and external landscape.